welcome to our final day of Dallas Weekly's special edition on health. We are covering asthma today, and we are very lucky and blessed to have two people with us from Parkland. Dr. Cesar Termulo, the Associate Medical Director at Hatcher Station Health Center and Parkland Health and Hospital System, and Ms. Jessica Hernandez, Senior Vice President of Community Integrated Health at Parkland Health and Hospital System. Thank you both for joining us.
Thank you for having us.
We thank you again. So let's start it off with just some simple stuff. Let's start with you, Dr. Termulo. So let's talk about what exactly is asthma.
So asthma is a chronic lung condition. It's a respiratory condition. And if you think about it, when we breathe in, the oxygen goes into we breathe into our throat, and it goes down these air passages into our lungs. And with asthma, the air passages can get plugged up and can get inflamed, and it can even close down to a point where it's difficult for oxygen to get into our lungs and to even breathe. And so that's what happens with asthma. It causes a lot of problems with like coughing and wheezing and difficulty breathing. So that's, in a nutshell, that's what asthma is.
Okay. And how prevalent, or let me ask you a different question. The risk of asthma, how high is the risk of asthma specifically for African Americans and let's say minority communities in general?
Well, for minority communities in general, and also the African American population, they are at much greater risk of asthma. They have 40% higher chance to have asthma than non-Hispanic Blacks have a 40% chance higher of having asthma than non-Hispanic whites. And a lot of it is because of it could be, number one, it could be genetic if there's a family history. But second of all, it could be environmental. If we live in crowded living conditions where infections are more easily spread, if there's environmental exposure to things like mold in apartments, or if there's cockroaches, those are things that can seriously trigger asthma. And then the third reason that can also cause minority populations to be at higher risk is because if there's an inability or inaccessibility of doctors in their areas, it puts them at greater risk for asthma because asthma cannot be well taken care of.
So would it be fair to say that environment has a major role to play in, getting asthma or, having symptoms of asthma?
Definitely. If it, I'm a pediatrician, so I'll talk a lot about children. If a child has been exposed to things such as smoke, I didn't mention smoke. Smoking is another big factor. So a lot of these conditions, such as high exposure to infections or smoking, if they're exposed to things like mold in apartments, those are things that can trigger an asthma attack for sure.
Considering the children, like you just said, is there are there a greater risk for children, or are there ways that parents can look out for those things, even if their environment, like you said, is a little bit, conducive to contracting asthma?
Yeah, definitely. Living and working in Fair Park, where I serve, there are a lot of patients who do live in disadvantaged communities. However, coming to the clinic, even if they're exposed to a high level of smoke or infection, or live in crowded conditions, we can take care of their asthma. Taking care of asthma, it's kind of like taking care of a car. You have to bring it in every now and then for checkups and things like that to make sure that things are under control. So that's the difficulty with asthma and with a lot of chronic medical conditions. They need to be able to come to a doctor with regularity so we can check to see how their asthma is. Oftentimes there may be like hidden symptoms of asthma that aren't really seen just in daily activities. But these are things that we could check and put them on medications to control their asthma, such that if they are exposed to things that could normally cause one to have an asthma attack, we can avoid that. So a lot of what is key is that they come to a doctor with regularity so that we can watch out for those hidden symptoms of asthma. There can be hidden symptoms like they don't have many symptoms during the day, but if they run a mile, then they might start to cough. Or at night, they might have a little bit of cough at night. Well, those could be hidden symptoms of asthma. And if we can try to see a patient with some regularity, we can try to tease that out and put them on medications to get that asthma under control.
Okay. And as far as health disparities go, we know that African American communities and other minority communities are more likely to contract certain diseases or fall ill in certain ways than, say, their white counterparts. When it comes to African American adults and children, is this consistent, and what accounts for these differences, if it is consistent?
Well, yeah, I think that it is true, and it is consistent that there is greater risk for in the African American and the minority community, as mentioned. And for instance, if there's not as much accessibility for a physician in these communities, if it's harder to get to the doctor, then if a child has uncontrolled asthma, they might just go out to play in a field, and if the pollen levels are high, they might get an asthma attack. And in other populations where there's greater accessibility to a doctor, if they might have the same asthma, but they've been going to the doctor and they've been put on, we call them controller medications to keep them under control, they might not get an asthma attack. So for the minority populations that don't have as much access to doctors, you might have the same kind of asthma, but if the doctor hasn't given the right medicines or any medicines to keep it under control, they might be at high risk for asthma that other populations might not be as much risk for.
Okay. My mother's developed asthma later in life. We have this sort of allergy that goes through our family. It's basically like hay fever pollen, but she actually developed asthma. Is that common? And how does asthma just develop in adults if they haven't had previous asthma, symptoms or even just asthma as a child?
Yeah, it might happen different ways. Part of it might be that there might have been a low level of asthma that didn't really develop until they were an adult. It wasn't noticed until they were adult. As I mentioned, there are kind of these hidden symptoms of asthma. It's sometimes hard to ferret out. Second thing, it could be like later in life exposure to smoking that could provoke symptoms of asthma. So there might be an underlying like hyperreactivity of the lungs that might not come out until they get exposed to certain triggers such as smoking. Another possibility is allergies. Oftentimes, if one has a certain predisposition to asthma for certain allergies, but they move to and as a child they weren't exposed to it, but then they move to an area that's high in a particular allergy, such as ragweed. Here there's high levels of ragweed, so it could develop after you move to an area that is triggered by a certain allergy.
Okay. Let me switch it over to Ms. Hernandez for a second. Let's talk about how Parkland is dealing with asthma in Dallas County. We all know that Parkland does a lot of studies and statistical analysis of things. Is there any information about which specific zip codes might have these asthma developments and that Parkland can give the public?
Sure. So as you're aware, Parkland conducted a community health needs assessment. And, through our pediatric services that are provided, we knew that asthma, specifically in children, was problematic. The assessment, I think, was pivotal in helping us identify the geographic areas and populations that experience the most significant health disparities. And so we've chosen to focus on these zip codes, in particular when looking at an intervention for pediatric asthma. And those zip codes are 75210, 75211, 75215, 75216, 75217, and 75241.
That was more zip codes than I thought you were going to name. So
yeah.
that is interesting.
Very unfortunate.
So how do y'all take the data and analyze it to even assess that these are the places we need to go and this is what we need to do?
So we take a look at the data internal to Parkland, such as our medical record. So part of the data that we looked at is we take information and collect it into what we call registries. And we take our existing patient populations that we serve and look at the diseases that are documented and the zip codes in which they live. We also have a great partnership with the Parkland Center for Clinical Innovation that takes a look at data beyond even our medical record, looks at billing data from Medicaid, health plans, to look at where in the county we are seeing asthma being diagnosed, and then importantly, where the high risk areas are. So which zip codes are we seeing children hit the emergency department because they're having difficulty managing their asthma? So we use a lot of data to try to determine where to focus our interventions. And as I mentioned, PCCI uses a predictive model that helps us understand where the high risk and the medium risk families live.
Okay. And what have been some of the results from this pediatric asthma program?
So for the CHNA initiative, we began enrolling patients. Last year was our first year in doing that. What I can share with you in terms of results is that we took this program as a best practice. So PCCI had previously partnered with the Parkland Community Health Plan to enroll children in a text messaging program. And so the results from that program led us to implement this in these zip codes that I've mentioned. So in the original group with our health plan, they did see an increase in prescriptions for controlled medications, as Dr. Termulo mentioned, by providers. They saw a 30% reduction in ED visits, and they saw a 42% reduction in asthma-related inpatient admissions.
Okay.
And so those types of results led us to where we are today, which is enrolling a much broader group of patients beyond just Parkland. So we're partnering with Dallas Independent School District to help us identify patients that are asthmatic that would benefit from enrolling in this program.
Okay. I guess finally, are there any additional programs that Parkland is planning to combat asthma specifically in the African American community?
So, when we take a look at the CHNA initiative, we're looking for a collaborative approach. So we know that Parkland can't do this all by ourselves. I mean, it takes a lot of organizations looking to improve the health of individuals in our community. And so when I talk about a collaborative approach, I talk about the DISD and the school nurses helping us identify patients. Another program that we have is we have partnered with Positive Breathing, which is a program that is led by Shamara Norris. She takes services into the community very similar to what we do. She attends health fairs and school events. She educates individuals in daycare centers what to look for. She talks to parents. She has a medical mobile unit. So that's someone that we partner that is in the community, going into the areas that we're targeting that can help increase services. We also have an access to care initiative under our CHNA, And that is taking our Parkland staff out into the community, into community-based organizations that our patients frequent, perhaps for other services. And we are there providing screenings. And so we are screening for hypertension, we're screening for diabetes, and we'll very quickly here be screening for asthma as well. So we have a couple of programs going on to help identify patients who need care. And so if we come across an individual that has a PCP in the community, that's fantastic. We will refer the patient to that PCP. But if we encounter someone who does not, we would be more than happy to enroll them into the Parkland Community Health Plan or our financial assistance program and get them into one of our health centers to get care.
Okay.
Sorry, to piggyback on that also, with we've also partnering with the Dallas County Health Department.
Yep.
And with them, they have they're going to be doing home visits. So with a lot of the data that we get from the asthma risk prediction model from PCCI, they're going to take those like high risk and very high risk patients and actually go out to the home, and they can help screen for a lot of these environmental risk factors that we had discussed. So we're also partnering with Dallas County to be able to make that happen as well.
Okay. So Dr. Termulo, answer me this. So asthma, is it curable or is it just treatable? And if it is treatable, how do you treat it?
Well, technically, we don't like to say that it's cured because I've had a lot of patients who they've not taken any medicines for 5 years and then boom, they get an asthma attack. So I don't like to say that it's cured, but it's definitely treatable to a point that we can prevent asthma attacks. As I mentioned before, there's different kind of medicines. There's a treatment for when one has an asthma attack, which is like their rescue medicine. But there's also something like a controller medicine that you take every day to reduce kind of that inflammation in the lungs, so that if they're exposed to a trigger for asthma, they don't develop an asthma attack. So if we can see an asthma patient who might have bad asthma, if we can see them with regularity and put them on medications to keep them under control, then they can have a normal function and a normal life. You know, I remember one time I was working in the children's ER, and Jackie Joyner-Kersey walked in, and little did I know that she had bad asthma, but you know, she was able to keep her asthma under control to where she won 5 gold medals. And so that's our hope with our patients as well, that you know, even if they have bad asthma, and even if they're exposed to a lot of these environmental triggers, we can keep their asthma in control, that they can have a normal function with their lives.
Okay. And Ms. Hernandez, as far as Parkland goes, are you just trying to make a bunch of Jackie Joyner-Kerseys, or what's the goal? What's there to accomplish?
So our goal is really to help individuals live their best life, their best quality of life. You know, we talk about the enrollment of these individuals because the digital interventions, like Dr. Termulo said, are very helpful. They remind patients that it might be a bad air quality day today, so be cautious. They remind patients that there are triggers and what to look for. Remind patients to take their medications regularly. What we're hoping with this particular program and with our CHNA is, of course, to create health equity, so that we provide the resources our patients need in order to live well. The benefits to helping our children that are asthmatic is that they miss fewer classes. So that helps in terms of their improved mental health, being with their peers, being more successful in school because they are in school more days. I mean, that's what's in it for, DISD. It's also impactful on a household. If we have children who are not missing school, then we don't have parents who are missing work days to take care of their children and perhaps, impacting the income that's available to the family. So we really try to look at this in a very holistic way. I mentioned our access to care initiatives, and Dr. Termulo touched on it a bit. We're really there to address some of the social determinants of health that are impacting, because if you can't make it, as Dr. Termulo said, to your doctor's appointment, we want to be there to help you with transportation. If you feel you can't afford the doctor's appointment, we want to be there to help, let you know what programs you may be eligible that will allow you to visit your doctor on a regular basis and get your prescriptions filled. So we are looking for people to have the resources, the knowledge, to be able to live healthy and live well.
Okay. I guess finally, Dr. Termulo, what would you want the African American community to understand about asthma as like a final takeaway? What is the most important thing they should know?
I think the most important thing to know is that lots of times there might be these hidden symptoms of asthma. 15% of African American children have asthma, but lots of times these symptoms are hidden. And so I think that the takeaway point is please see a doctor to check to see if your child might have asthma, because there are many patients who are or students who are running around in the community that do have asthma and that are unaware of it, and that they should be checked.
Well, I want to thank you both for joining us and giving us all this information. For those that have been watching all week, we appreciate your time. And you can, of course, catch this and more of our health content on our website at dallasweekly.com. We will be sharing most of this, if not all of this information, on our socials. You can follow us there. And as always, please, please, please go get screened, go get checked, create a yearly calendar for yourself to go to the doctor. It is important, if we learn anything from this week, it is that our community is suffering from treatable diseases and treatable afflictions more than anyone else. And a lot of that is access, knowledge, and awareness. So let's keep this going after April. We want to thank our doctors and administrators from Parkland all this week. And of course, our audience for joining us. Again, I'm Patrick Washington from the Dallas Weekly, and we'll see you next time.